Hello, welcome back to my channel. My name is Sugandha and I work as a doctor here in New Delhi. In today's video, we will talk about rheumatoid arthritis. So let's get started. What is rheumatoid arthritis or RA? Well, RA is a chronic inflammatory disease. It is an autoimmune disorder where our own immune system mistakenly attacks our own body tissues. That is, it can affect the joints of the hand, it can attack the joints of the feet, the arms, the legs, thereby causing inflammation and ultimately resulting in painful swelling. Our immune system normally makes antibodies that attack bacteria, viruses, and other foreign materials. RA generally affects the young and the middle-aged females, but males may also be affected. As I said, RA is a chronic inflammatory disorder that causes the arthritis of the joints, hands, and the feet and the ankles. Unlike the wear and tear of the damage caused by osteoarthritis, RA is different. It affects the lining of your joints, resulting in painful swelling that can eventually result in bone erosion and may lead to deformity. Now, who can get affected by RA? One can get RA at any age. It could be any age. RA most likely affects females more than men. Generally, women in their 30s to 50s are usually affected by RA, and it also affects males. RA is quite heritable. I mean, there is some genetic sort of connection that people usually found in these kind of patients. There are patients who have family members who are affected by RA. If your parents or your grandparents had RA in their life, you are at a greater risk of attaining RA. In addition, a very common association is seen in people who smoke, especially male patients. So that means people who are smokers, they are at a greater risk of developing RA. Also, it has been seen people who are overweight or people who are obese, they also have a greater ability or a greater chance to develop the risk of rheumatoid arthritis. Now, how will you recognize that you have developed rheumatoid arthritis? So, symptoms of RA, they generally develop within weeks, but in few patients, RA has seen to be occurring in few days. The symptoms, it varies from person to person, and it may come and go or change with the passage of time. Symptoms of RA include swelling, there will be pain, there will be morning stiffness, and sometimes this may lead to deformity. The patient has difficulty doing basic and daily activities like while getting in the morning and then brushing their teeth and then combing their hair. That is the first things we people usually do when we get up from bed. However, after some time, after an hour or after a couple of hours, the patient starts to feel better. Many people with rheumatoid arthritis, they get very tired very easily, and some may also present with low-grade fever. Now, a very common question that people usually ask when they have RA is, what are the RA flare symptoms? So, the presence of new swollen joints or joints that were previously inactive and were not paining, they suddenly start to swell up. They show redness, they show stiffness, and when they develop extreme pain, you should consider it as a flaring symptom of rheumatoid arthritis. So that was all about today's video. In our next video, we'll talk more about rheumatoid arthritis. And please don't forget to like, subscribe and share my channel, and please comment on it, and thank you very much for watching.